Let's take you live to the Health Minister, and here's the Chief Medical Officer with him, Brendan Murphy, as well.
Doug, do you want to say something first and then we'll move on?
It's great to see so many people interested in our new Drug Discovery Centre. It's fantastic. It's good to welcome you to the Walter and Eliza Hall Institute of Medical Research. My name's Doug Hilton. I'm Director of the Institute. And I just really wanted to start by acknowledging the health ministers and their collaboration around this centre, but I think much more from a community viewpoint. Thank the health ministers, their staff, the chief medical officers around Australia, the chief health officers, for their collaboration around this infectious disease crisis. So that is something that makes me very proud as a medical researcher and proud as an Australian. There is wonderful research being done on COVID-19 here at the Institute, but it's being done in the collaboration with remarkable researchers at the Doherty Institute, our fabulous universities and our hospitals. And again, I think that collaborative spirit of Australian health and medical research really allows us to make a contribution to this global pandemic. And with that, I'll obviously let the ministers answer the questions that you're most interested in asking.
I'll speak briefly. Look, thanks very much to Doug and to Jenny. I think Doug's points about collaboration are absolutely right. This is a combination of medical research, the Victorian government and the Australian government all working together. It happens to be a National Drug Discovery Centre, but much more importantly, it is one of the many parts of the Victorian and Australian medical research system which is contributing to the global push for treatments, for cures and for vaccines. Here at the Drug Discovery Centre there is the potential for work on recovery and treatment. So in particular a focus on antivirals and potentially respiratory medicine to assist with patients recovering from and having better outcomes if they do contract coronavirus or COVID-19. This centre has the potential to help lead the world in people recovering from and potentially finding a cure to coronavirus. Across the road at the Doherty Institute, they helped us find a leading approach to testing for coronavirus, the ability for Australia to have faster tests and to share that information with the world. That's why this is so important. More generally, the latest update that I have just prior to coming here from the National Incidence Centre is that there are now 118 countries with cases of coronavirus that have been identified, 125,000 cases confirmed globally, and approximately 4,600 lives lost, sadly. In Australia, we have 128 cases that have been confirmed and reported to the National Incidence Centre, and as we receive those, we update twice daily. More significantly, I want to add even further our support to those individuals and their families who might be diagnosed. It can be a very stressful time, and we want to add our support to each and every individual and to indicate that this is about a country and a community supporting them to provide the way through. Today, the National Security Committee of Cabinet has met and decided to reaffirm and continue, following the medical advice, all existing country travel bans, and the Prime Minister has also referred the question of all travel from Europe to the National Security, from the National Security Committee to the medical experts. So just to repeat, the Prime Minister has referred the question of all travel from Europe to the medical experts at the Australian Health Protection Principles Committee, and we will continue to follow the medical advice. And the reason we've done that is that it has allowed us to be ahead of the curve, one of the first in the world to put in place a China travel ban and similarly an Iranian travel ban. Some of our decisions that have allowed us to stand up the National Incidence Centre, the National Medical Stockpile, the National Trauma Centre early, and these have allowed us in treating, isolating and ensuring that cases are being prevented wherever possible, and we are working with our amazing states, and I do want to emphasise this, with our amazing states to provide the best possible care.